AIDA, attention, interest, decision, action. It is the salesman's mantra. Get them to sign on the line that is dotted. A, attention. Do I have your attention? I, interest. You're on the lot, so I know you're interested. D, decision. Have you made your decision for Christ? A, action. It's the formulaic expression of a coffee foreclosure sale from Glengarry Glen Ross and the National Bureau of Economic Research, NBER, which is ranked second only to the Brookings Institute for Economic Research, recently published in September 2022 a non-peer-reviewed working paper. It is written by three scholars. Jacob Wallace, a professor of public health at Yale University. Paul Goldsmith Pinkham, an assistant professor of finance at the Yale School of Management. And Jason L. Schwartz, an associate professor of public health at Yale University, lending that reputation of an Ivy League college to bolster confidence in the study and for those who appreciate the finer things in life and who may prefer the fine German craftsmanship in an automobile that is luxury. This factor alone may be enough to get you on the lot, and also to get you to buy sight unseen. A BMW ain't out yet, but you look like an intelligent person and probably want to make that salesman work for his money, even though if you're on the lot, you want to give him your money. And these three Yale professors at a prestigious economics research group institute let you know they have been busy at work crunching the numbers so you don't have to. You're too busy. We want to make it convenient for you to give you what you want while you give us your money. Would you like to take a look under the hood? Well, they had computed an estimate, just an estimate, or mathematical projection model based upon only estimates of excess deaths in the states of Florida and Ohio for persons aged 25 and older between January 2018, before the pandemic, to get a baseline, and December 2021 at the beginning of the COVID-19 countermeasures rollout. And under the emergency use authorization, that is exactly how they were described. Not vaccines, but COVID-19 countermeasures products. But most people just call them vaccines. But you look like an intelligent person. Why didn't they call them vaccines in March 2020 when the emergency use authorization was published? Well, one reason is that they didn't have a vaccine yet. They hadn't yet developed and tested for safety and efficacy. Efficacy, which is distinct from effectiveness. They sound a lot alike, but there is a distinction with the difference, and that's why these countermeasures products for COVID-19 were first released under an emergency use authorization. Efficacy only means that when the product interacts with the virus, something happens, some kind of immune response reaction, which for the Pfizer product was quantifiably measured as about 3-fold in increase in immune response activity. Whether that was sufficient or not, they could not tell you. Why? Because the COVID-19 countermeasures products had not yet been fully tested and required more data over time, which is often described as a large stage 3 clinical trial. Maybe you want to be the first one on your block to be vaccinated. And the only way to expedite that process is to determine what is described as the infectious dose, or the amount of disease to which a person must be exposed before causing an infection. But as of March, April, May 2021, the last update at the CDC, that quantifiable number remains unknown. We don't know. And so now we have a projection, which is not raw data, and they're doing a metadata analysis with some guesstimates on numbers compiled from 577,659 total deaths of individuals linked to their 2017 voting records between January 2020, marking the arrival of COVID-19, and January 22 as the end mark for the study. And they began this report on research findings with the reminder that coronavirus 2019, COVID-19, has caused over 1 million deaths in the United States. A little sticker shock value, leading to considerable interest in identifying risk factors for COVID-19 mortality. And they indicate that political affiliation has emerged as one potentially significant risk factor amid evidence that Republican-leaning counties have had higher COVID-19 death rates than Democrat-leaning counties. And you may recall back in June 2020 in the Washington Post story regarding the non-medical grade facial coverings test, the observational studies, 172 that were reviewed in a study commissioned by the World Health Organization, a hasty review of metadata analysis for non-medical grade facial coverings, which many have elected to call masks, which would imply respiratory protection, but they are not. They are non-medical grade facial coverings. And the Washington Post had noted that months of discord about the coronavirus epidemic have transformed the cloth mask into a potent political symbol touted by Democrats as a key part of communal responsibility, labeled by some GOP leaders as a sign of government overreach and as a scarlet letter pinned on the weak. At any point inside those consumer attitudes, did you hear anything about science, or did you just hear about how people felt based upon ideology in a pandemic? No, you did not. But this hypothesis of 3 professors at Yale University, 2 public health professors, not medical doctors, and 1 finance professor is informed based upon this observation in the Washington Post and perhaps anecdotal observations that Democrats are Democrats, Republicans and Republicans have different consumer attitudes for safety products during a pandemic, which according to the Data Institute at the University of San Francisco are at times historically associated with fear, confusion, and despair. But you look like an intelligent person, calm, cool, and collected, ready to go on that next James Bond mission, living the life of adventure, carpe diem, and that probably doesn't apply to you, right? In pandemics, an educated consumer is our best customer. And if you read the report, you know it is 13 pages in page count. 6 pages are just appendix references and definitions. 1 page is cover. 1 page is dedicated to a big colorful graph for our visual learners. And that leaves us with how many pages? Do the math. 13 minus 1, 2, and 6 makes... Do the math. So just 4 little quick and easy to read pages in a pandemic in which over 1 million died. Did you read the report? Did you read the 40-page report at the beginning of the pandemic? Probably not. But you listen to the sales promotions on television and in your favorite echo chamber news content providers. You look like an intelligent person, though. So you already know that at the very beginning, these professors at Yale University made some early disclosures stating about the non-peer-reviewed working study that is unknown whether this county-level association, which may be subject to ecological fallacy, persists at the individual level. And so for an educated consumer, upon hearing what should be your first question? How about what is ecological fallacy, right? You gotta look it up and not just nod your head in agreement, trying to look intelligent about a big decision, because what the salesman's gonna do, he's just gonna try to get you saying yes. Ecological fallacy? Yeah, sure, I heard something about that. No, an ecological fallacy is a failure in reasoning. Not quite thinking logically, like Mr. Spock on the Enterprise. And this arises when an inference is made about an individual based upon an aggregate data group, or what many describe as prejudice, stereotyping. All Republicans or all Democrats may not actually think alike. And you know what happens when you assume, right? But that's what they did in their scientific study. And why is that important? Did you hear that they told you that this was a projection based upon over 500,000 individuals? Did 500,000 Americans die from COVID-19 in Florida and Ohio? No, that's the total number of people who died. And on top of this raw data, they just assigned party affiliation based upon statistics, like a large acetate overlay you might put on a topographical map. And they tell you at the beginning, the only thing they were doing was looking at counties in Florida and Ohio, another overlay. And if we already know that big Democrat counties lean towards getting vaccinated and big Republican counties lean against, what scholar needs a calculator to figure out anything more? But they say that prior research has also established differences in vaccination attitudes and social distancing based on political party affiliation. But it has been more difficult thus far to establish corresponding links to health outcomes due to data limitations, of which they give you quite a few in this study alone, just in case you missed that memo. And they report 2 major findings in this non-peer-reviewed working paper. First, in the COVID pre-vaccine period, the association between excess death rates and county-level vaccination rates are nearly identical for Democrats and Republicans. And second, in the COVID post-vaccine period, there is a clear visual difference between Democrats and Republicans. Do you believe everything you see? Well, they say with higher excess death rates for Republicans in counties with lower vaccination rates. And they suggest that, by comparison, the difference in excess deaths between Republicans and Democrats is nearly zero in counties with the highest vaccination rates. And conveniently, complete with colorful charts and graphs for visual association, the suggestion from this non-peer-reviewed research is from professors at Yale University is that they hypothesized or made an educated guess that in Democrat highly vaccinated counties, deaths would be lower because they were fully compliant, while in Republican counties, they should expect the opposite. You asked for it, you got it. And what did these three Yale professors determine from their projections in a working paper? They wanted to prove their hypotheses, right? Sure, you don't want to find out you failed, that you lost your own bet. Political party affiliation was associated with excess death rates at the individual level during the initial years of COVID-19 pandemic. Let that sink in. Political party affiliation was associated with excess death rates at the individual level during the initial years of the COVID-19 pandemic. So there were some winners and losers according to this working paper, and they reported that registered Republicans in Florida and Ohio had higher excess death rates than registered Democrats, driven by a large mortality gap in the period after all adults were eligible for vaccines. You could have taken the vaccines, you didn't take the vaccines, you died. You asked for it and you got it. Now, what these Yale scholars, professors, had determined is couched in what are essentially like those warranty waivers you get at the car dealership. Like when they tell you the car is being sold as is, and maybe let you know something that might not work like it should or would have had you purchased a brand new car with a full bumper-to-bumper warranty. And in research papers, these require disclosures which have the effect of making it look like being forthcomingness, giving customer assurances are called limitations. In other words, they had their mechanics look at the product, go under the hood, and they want to let you know that everything may be okay, but you might want to check back on these particular things a little later should a problem develop after you roll off the lot. Of course, we're confident it won't, but just in case that happens. And they state that, and of course, you want to buy that car so you don't care about that. And they state that first, our mortality data, while detailed and recent, only includes approximately 80% of deaths in the U.S. However, excess death patterns in our data are similar to those in other reliable sources. So, this over 500,000 fatalities that they had examined is not only not the folks who died in Ohio and Florida from all causes, but only about 80% of all Americans who had died from all causes to determine the baseline for calculating excess deaths. And second, because we did not have information on an individual's vaccination status, analyses of the association between vaccination rates and excess deaths relied on county-level vaccination rates, kind of guesstimating. So even though there was a strong implication that Republicans who were unvaccinated in Republican-controlled counties just based upon anecdotal assumptions about Republicans and overlaying that assumption that if you reside in a Republican county, you must therefore be a Republican, but also they are informing readers that they don't know whether the people who actually died from COVID-19 were actually unvaccinated or not. Would that not be an incredible finding that the people who died in Republican counties were not Republicans at all? And, well, they may have been Republicans, but they were actually fully vaccinated. They may have just lived in the wrong place at the wrong time and getting the virus. And this is called reasonable doubt in criminal prosecution, as Bruce Aylward, the assistant WHO director, says, is a function of coming in contact with someone who has the virus. You can't get a virus from somebody who isn't there. How much viral load they are shedding. Have to have an infectious dose delivered to you to actually make you sick, and how long you are exposed to that person. And in recent research, we have found that your chances of getting the Omicron variant from your roommate, which whom you have the optimal exposures over extended periods is actually 42.1%, or less than a chance of, actually have a greater chance of winning a coin toss against your roommate than catching COVID-19 from him, even if he hasn't, or her. And finally, in limitations of the study, the Yale scholars inform readers that our study is based on data from the only states where we could obtain voter registration information, Florida and Ohio. Hence, our results may not generalize to other states. So they are suggesting that they were not trying to cherry pick states, big, battleground states to get good numbers, but these two states were the only states where they could obtain voting information. Nobody else apparently has voting information they say that was usable for their research. Bottom line, with all of the mandatory disclosures out there, out front, is that our results suggested political party affiliation only became a substantial risk factor in Ohio and Florida after vaccines were widely available. And we do not observe a statistically significant association between the county level vaccination rate and the Republican-Democrat excess death gap until after the vaccine is widely available. So essentially, these Yale scholars have conceded that if you wore the mask or if you locked down before the vaccines, it had absolutely no effect. You stopped going to church, you closed your business, you canceled vaccines, you stopped eating out at restaurants, and kept your kids from school for nothing, according to these researchers at Yale University. And not until the vaccines became widely available did they find any statistical difference in mortality or persons dying. However, they couch this conclusion in the caveat: lack of individual level vaccination status limits our ability to draw broad conclusions. Or simply, they don't know if the deaths were actually people who refused to take the vaccines. But they argue that the results suggest that the well-documented differences in vaccination attitudes, how people feel, and reported uptake between Republicans and Democrats have already had serious consequences for the severity and trajectory of pandemic in the United States. So basically, how you feel, what you think is what you do. There's no difference between action and thought. Just like Jimmy Carter, they have lusted for other women in their hearts, so therefore they did it, and shall incur the wrath of an angry God of science. And they warn, these economics scholars from Yale warn, that if these differences in vaccination by political party affiliation persist, if you continue to be a Republican and continue to not take the vaccine, then the higher excess death rate among Republicans is likely to continue through the subsequent stages of the COVID-19 pandemic, which some say is over and some say continues. Plain and simple sales pitch: take the vaccine. If you caught COVID-19, you asked for it and you got it. The science was wrong about the masks and wrong about the lockdowns. They're coming up front, being honest with you, giving you those disclosures to give you assurances, but the vaccines seem to work. At least this is what this limited data suggests right now in this working paper from economics scholars at Yale University. And thanks for your patient participation in our market research study during a deadly pandemic. And hopefully the vaccines too shall work.
This advertisement was authorized by Mike Webb.